Hey folks, penile injection therapy is hands down the most effective therapy we have when it comes to medications to improve erectile function. But a big concern from patients who haven't yet tried these therapies or those who are using the therapies is that the medication and the injection can be uncomfortable or maybe not effective all the time. My name is Dr. Amy Perlman. I'm a board certified urologist with expertise in sexual, hormonal, and genitourinary health. And today we're going to talk about tips and tricks for optimizing the use of penile injection therapy. Now, what I'm about to share, I've learned from my patients. They've given me so much knowledge over the years in terms of trying different things. I've learned from pharmacists, I've learned from companies like MenMD who offer a lot of these penile injection therapies and also do a great job with patient education. So I'm always learning about ways to optimize therapy. So today we'll focus on optimizing penile injection therapy. Let's begin with what is penile injection therapy? It's essentially some very powerful medication that you typically get in a pre-mixed vial. Drop the medication and you self-titrate the medication to your needs. So a typical needle and syringe would be an insulin needle and syringe. I'm showing it to you here. It is a very small needle. Okay, you can barely even see it on the screen. And what you would do is you would draw up the medication. And I'm typically using trimix, which is a combination of 3 medications. You can also do bimix, which is a combination of 2. You can do a single agent medication. You can even do a combination of 4 different medicines. It's always about just titrating for the patient. There are some times where I might lower a dose of one medication, increase a dose of another, depending on tolerability and efficacy. All right, so what the person would do is they would take this needle. I typically have people inject about mid-shaft on either side of the penis. They're going to put the needle in the side at 10 or 2 o'clock and then inject the medication. The nice thing about penile injection therapy is its onset of action is pretty quick. So it can take effect within like 5 to 15 minutes compared to a lot of the other therapies, which are also very effective, like the pills. They just tend to take longer to take effect, 45 minutes to about 2 hours, depending on the medication. All right, so the injection itself is easy, but again, I do have a lot of people that say it's just a bit uncomfortable, whether it's from the medication or the injection. So let's talk about ways around that. I want to talk about some accessories here. If you look at a standard insulin syringe, the numbers and the markings are a little bit small. So if your eyesight isn't so great, you can actually get the Insul Ease, which is this little device right here. And it's something that you actually fit over the syringe and it acts like a magnifier to increase the size by 2 times. And that can more easily show you the numbers and the lines. You don't want to mess up the dose on penile injection therapy. It is a very powerful medication. And if you inject too much, you can get a painful, prolonged erection that can actually worsen erectile function over time. So we definitely don't want that. You want to make sure you know exactly how much you're injecting. So this little, device that you can put over this syringe to better see the numbers may be helpful. Another device that you might want to consider is an auto injector. And the auto injector is called Inject Ease. Okay, so that's easy enough to remember, Inject Ease. And it comes, this is one product here, okay? And there are different adapters depending on the size of the syringe that you're using. For example, it comes with one here that's for a 100 unit or 1 mil syringe. That's the one that I'm using. So that's the adapter I'm going to use. But the other options include one for a 30 unit or 0.3 mil syringe and the other for a 50 or 0.5 mil syringe. To attach this, all we do is slide this bad boy on like so. Okay. What I'm going to do here with my insulin needle and syringe is after I use an alcohol swab to clean the top of this rubber stopper here of the vial, I'm going to put my needle in, I'm going to turn the vial upside down, and I'm going to draw up however much of this I need. Let's say for today's demonstration, I'm going to inject 30 units, which is the same thing as 0.3 milliliters. Now I'm going to recap my needle. And you want to recap this before putting it into the auto injector so you don't contaminate the needle. Now, this part right here, this lever is open. This is in its closed state. This is open. So we're going to keep it open here. And then we're going to just slide the syringe in the back, and we can see you kind of have to pop it through a little bit with the cap on. Okay, so you can see it through the tip of the auto injector there. And then we're just going to secure this backing. So I'm just pushing that forward. Now, this little button right here is going to deploy this needle. So I want to do that so I can end up more easily taking the cap off. So I'm going to push this button right here. I can see it deployed the needle. Now I'm going to take the cap off so I have the needle exposed. And then all I'm going to do is I'm going to just bring this whole thing back. So now my needle is hidden. Now we're ready to put this along the side of the penis because we're getting ready for our injection. So I would take an alcohol swab. I would wipe the side of the penis to clean the skin. And then you're going to just push this in the tissue, okay? And then to deploy the needle into the penile tissue, I'm going to push this button right here. Okay, so that deployed the needle. And then I actually have to push the back part of the syringe here to inject the actual medication. And then I take this out, and you can see that needle was deployed. And now I'm going to just lift that back out. I'm going to open this up, and I'm going to remove my needle and syringe from the auto injector. So that's very easy to do. It's a nice trick to consider for people who just can't quite get past actually putting the needle in their skin. Really, the advantage of an auto injector is you just push the button and it deploys the needle for you. And I've had some patients that say it was very helpful. When we go over some of these other techniques, which we already discussed, I have a lot of other patients that say, you know what, I'm actually fine doing it because it's actually not painful or it's very tolerable. And so I don't need an auto injector. So just something to consider, another tool in the toolbox for making your injections a little bit easier and more tolerable. And then lastly, when it comes to injection technique, I actually had a gentleman recently tell me that he tolerates the injection better when he actually puts his penis on stretch. And he explained to me, this guy's an engineer, very smart guy, that when you put the penis on stretch, then when you inject or you insert the needle, you're not going through as many skin cell layers. And so it's better tolerated. I don't have any science or research to support that claim, but it certainly makes sense and would be something to try. So when you're doing the injection, what you can do is hold the penis on stretch, maybe like on the opposite inner thigh. So you're really exposing the lateral aspect or the side of the penis. So you hold this on stretch, and then you can go ahead and just put your needle in the side. So I thought that was a great tip, and it might be something to try yourself. And then the last thing is, especially if you're traveling, then you do want to keep this medication cold, and you might consider getting an insole tote, which is a very discreet little package right here where you can keep extra syringes. You can put the medication over here, and then you'd also put an ice pack in here, and that will help keep your medication cold on the go. All right. That covers accessories that you might consider. Now let's talk about modifying injection technique. In addition to making administration easier, there are some techniques that can improve comfort during the actual injection. So did you know, or have you ever tried using a vacuum pump before injections? That was something that I never considered. Then I had patients start doing it, and they noticed great benefit. What I recommend is, especially, I'm a huge proponent of vacuum erection devices for penile rehabilitation. So any man who's not getting, daily erections with, medications or injections, I would recommend getting a vacuum pump. But it's really important to know that one of the downsides of penile injection therapy is that some men will form scar tissue in the penis, and not even necessarily from the needle or injection itself, but from the medication can cause fibrosis or scar tissue. So for a lot of my patients that do injections, I'm even recommending that they're using a vacuum pump, especially on days where they're, let's say, not doing an injection. We still want them to stretch their penile tissue on the non-injection days. But I've had a lot of patients use a vacuum pump like this one to engorge the tissue, stretch out the shaft before they actually do the injection, especially for men who have some penile retraction. Then using a vacuum pump before the injection can bring the tissue out and actually make it easier to see the injection site. I would highly recommend doing that. I've had a lot of great feedback from patients. The other thing to keep in mind here is that the medication should really go in like butter. If you're meeting resistance once the needle is in the penis and you're trying to inject the medication, you've probably hit something that isn't the erectile tissue, or you might have scar tissue in that area and it's just not going to allow the medication to go in. In that circumstance, you can move the needle in and out at that same skin puncture site to see if you can more easily inject the medication. If you're still meeting resistance, again, it really should go in like butter. Take the needle out, clean out, another spot of the penis, and go ahead and inject in another spot of the penis where it does go in like butter. Lastly, when it comes to injection technique, depending on the needle length, the depth of insertion does differ and it matters. So here are some general guidelines to follow. Most of the time for my patients, I am having them use a 5/16 inch needle. But it is a pretty short needle. And so sometimes that's not quite long enough to actually get into the erectile space for where you want to inject the medication. So if you're using a 5/16 inch of a needle, then when you put the needle in, you want to hub it and indent the skin a little bit. You can kind of see that on this demo. So go ahead and indent that tissue a little bit before you actually inject the medication. If you're using a slightly longer needle, which is going to be the 1/2 inch needle, then that needle is like slightly, too long for some people. And so the depth of insertion for a 1/2 inch needle is going to be like, if you could put like a quarter in between the skin and the hub of this syringe, that's kind of where you want to be. So you're not going quite all the way in. You do want to leave a little bit of a space there, and that should get you in the right spot. So aim for about 95% of the needle in that erectile tissue. And then lastly, when it comes to increasing or optimizing tolerability of this whole injection process, some people do get, some pain, whether it's related to the needle or the actual medication. One thing to keep in mind is sometimes just the formulation that you're getting can cause pain in the penis. And that's where we might change around the formulation a little bit to reduce. Alprostadil is typically the medication that causes pain in the penis. So typically I'm going to go down on that dose and maybe go up on some of the other medications. People tend to tolerate that better when I do that. And that would be in guys where they're not necessarily having pain with the insertion of the needle, but they have like a penile ache or pain in their penis while they have the erection, or even after they orgasm and ejaculate and the erection goes away, they might have a dull ache in their penis. Oftentimes that's from the medication itself, which can be changed when it comes to the formulation. But I do have some patients that may consider taking an over-the-counter pain reliever if they know that they're going to have some discomfort with the injection. So you can take that medication, something like Tylenol, prior to doing the injection, and sometimes that can do the trick. So the key takeaways here are, you got to know the right technique and the right accessories and the right different medication formulations that are available in order to optimize the therapy. And really, that's kind of like the holy grail there, because if you're using a medication like the penile injections, they're wildly effective. So we just want to make sure that when you're actually doing the injection, it's not giving you like a traumatic experience. You can actually tolerate it and maybe not even really feel it. That's what I've seen in a lot of patients. They had some issues. They were taught some of these techniques that we discussed today, and now they're loving their injections. Thank you so much for tuning in. For more tips and tricks and the ins and the outs and the do's and the don'ts when it comes to sexual health, hormonal health, and genitourinary health, please subscribe to my channel and stay tuned. Thank you.